There was a randomized phase 2 study, actually, that was conducted, I think Dr. Schlumberger in France was actually the PI of it. And what it did was it randomized patients to, it was one of the first actually large randomized trial. It was over 100 patients. And they had patients, I think about 150. Half of them had Vandetanib and half of them had placebo. And so we know in a very, very similar criteria to the decision trial as far as what the patient population were. And so we know that it actually works. It had, in the phase 2 study, it actually had significantly fewer, I would say, full responses, but in a tumor that's mostly asymptomatic. Progression-free survival is probably the big thing. And in that study, I think the progression-free survival is 11 to 12 months. So that's not so different from what we saw in decision. So there's clearly activity. And going back to what I said before, that there's very much a need to have more than one agent. You know, these patients, I would say of all the patients who go on sorafenib and fail sorafenib, 98% of them are going to need second line. So unlike other tumors where the second line, third line, fourth line are maybe not as attractive to develop agents for because there are fewer patients in it, this is very different in thyroid cancer because those patients stay pretty healthy. And if you actually have another agent ready to go, the ones that I have that don't stay healthy are the ones that are getting kind of a partial response, but they're starting to progress, and we had to keep them on longer because we didn't have other options. But if we actually have other options, we'll be really capturing 98% of those patients and giving them a second and third line therapy. I think they have a very good overall outlook, but only if we can continue to get those drugs into those settings.